Thank you for tuning in to The Real Tea with T3. My name is Tisha Harris, and I'm going to be your host today. I'm the team leader of Texas Trio Team, so we're going to go around and just introduce everybody of who you are and what keeps you busy these days.
I am Michelle Duty. I'm a realtor on the Texas Trio Team.
I'm Presley Bates, and I am a speech pathologist in the Brenham area.
So tell us about basically the field that you're in. Like, what specifically does that mean to somebody that may not know what that is?
Yes, I love the field of work that I'm in. It's practically a physical therapist, but for speech. And so we work on anything from infants that need help with actually the feeding aspect of how like your mouth works for feeding in newborns and infants. And then we work with little kids that are learning how to speak. We work with speech sounds. We work with language. We work with any feeding in toddlers. And then all the way up until adults that maybe need more of like the rehabilitation side of speech. So if they've had a stroke or any kind of traumatic brain injury, dementia, anything that is taking away their ability to speak or use language. So we work with all ages, kind of feeding and speech and language side, and I love it all.
Yeah, that's really exciting. So what led you down the path of wanting to do the field that you're in?
Yes, so I was in college. I went to Texas A&M, and they don't have speech pathology there. And so I was a communications major, just thinking I would go into the business world and do a marketing type sort of job. But I love kids. I love working with kids. I love working with people. And so I was kind of looking more into a job that would lead me down that path where that was my day-to-day interaction. And so I started looking into therapies, and I shadowed under some speech therapists one summer. And I absolutely loved how rewarding the job was, and just how close you can get to your patients and their families as they walk through this journey. And so I just fell in love with that aspect of it. And I had a lot more schooling ahead of me once I chose that career path, but I was ready to do it for this to be my job.
Yeah, that's really cool. So it wasn't available to you. So what was the light that you're like, it wasn't available at A&M. So what was it that you're like, this is the route that I want to go?
Yes. So it was not available at A&M, but I knew that I could graduate with my degree from A&M, and then it took a little extra schooling and then a grad school program to kind of switch paths. So I did that. I graduated from A&M, and then I went to Baylor right up the road and did my graduate program at Baylor. And I knew it was the right career path because anything else I looked at, and it had extra schooling, I was like, no, I'm not interested, don't want to do it. But I knew it was what I wanted to do when that was what was ahead of me, and I was like, okay, let's do it. I'm ready to do it. So
yeah. And so I'm so intrigued by like how you got a light bulb just by linguistics, like, and how important that is. And so can you kind of walk us through what that is for someone that, you know, may not be familiar with what you do for a living?
Yeah. So, you know, there's many different aspects of speech pathology, and that's one thing I love about this job is, you know, you don't get bored. It's not the same thing every day. And so there's the speech and language, which is probably the biggest part. And there's the development of children learning language and learning speech and walking them through that at that age, which is so interesting, and it's different for every child. And so that's what makes it so interesting. And so it's something different every day. It's something different in every child. So getting to walk through that with them. And then there's the whole rehabilitation side of it. And so that's for like adults that have language or have had language, but something has happened that has taken away their ability to use their language. And that side of it it's amazing as well. It's hard to walk through that with them. But it's amazing how the brain, how language is such a huge part of our lives, and how the brain can rehab itself to give us that back. And it's really, really rewarding to see. Obviously, language is so important. We use it every day. We use it to tell the people we love the most, I love you, and to see that come back to people, or to help them get back to that point, or to help little kids be able to communicate with their mom what they want is huge. And so it's super rewarding to get to be on that journey with patients.
Right. So can you kind of walk us through, like, if there was somebody that, we'll kind of do it by phases. So let's just say somebody's got like an infant, mm-hmm. like what would that look like if they were going to come and see you, and what would be the signs that a parent needs to look for in order to maybe navigate to get a speech therapist?
Yes. So typically around 2 years old is kind of when you want your child to be communicating with you using more than one word. So around 1, you want them to say their first words, and then that 1 to 2 year olds 1 to 2 years is kind of a grace period of just developing one word at a time. And then 2 years old, you kind of want them to start putting 2 words together, like want milk. And so if you see kind of around 2 years old that they're still just saying a word, or they're just saying 5 words, then it might just be a sign of like, I'm going to keep an eye on it. At 3 years old is kind of when we would want them to start coming to speech therapy. If, again, they're not putting those 2 words together, if they don't have about 50 words in their vocabulary. And then also on the other side, that's just the expressive part of it, but also receptively. If they're not understanding what you're asking them to do, if they're not simple commands of like, bring me your shoes, those kind of things, that's language as well. And if they're not understanding what's being communicated with them, that's kind of a red flag as well. So I think 3 years old is probably the most appropriate time to start speech therapy. And if your child's just not, putting words together, not using language, then I think that it would be beneficial for them to come in and start receiving therapy. That's kind of the language side of it, the speech sounds. 3 years old is a great age to look at it as well. They should be saying most of their sounds by 3 years old. There's still some later developing sounds to where they're 5 years old when they should be 100% intelligible. But a child can have great language at 3 years old, but they don't have their speech sounds developed yet, and so you can't understand what they're saying. So then that kind of hinders their use of their language. So a lot of times we do see, kids that have developed great language, but they're just having trouble with their speech sounds. Maybe it could be something structurally wrong in their mouths, or, some kids just develop speech sounds later. And so seeing them around 3 years old would be a great starting age for speech therapy.
And even like, little kids, it's really hard to understand what they're saying sometimes, just in general, if there's not like something that maybe have a disconnect. So how, like, beyond just those couple things, is there maybe some other signs that a parent could pay attention to?
Yes, absolutely. So it's really interesting how it's all connected. A lot of times speech sounds are having difficulty with speech sounds is connected to something structurally going on in their mouth. And so it could be a tongue tie, a cheek tie, a lip tie. It could be a high palate. It could be just weak muscles around their lips and in their tongue. And so there's different things if they're having trouble eating. So like before 2 years old, you don't get much speech out of them, but they do go through, being bottle fed and then like weaning into solid foods. And so you can kind of look through that process and see if they did that appropriately, or if they had some setbacks in their feeding development. A lot of times if they have a setback in their feeding development, then it'll be likely to show up in a speech development as well. Sleeping as well is a huge one. Your tongue is kind of supposed to rest on the roof of your mouth when you're asleep, and that kind of gives you a sensory feedback. And so a lot of times children have trouble sleeping because that's not happening. That will also translate into some speech difficulties down the road too. So if they're at an age where you can't really tell if they're having, they're not speaking, or you don't know if they're having speech sound difficulties, you can kind of look at other, developmental milestones and seeing if they hit those, or if they're having difficulty with other areas, and just kind of translate it into speech.
So you're basically like weeding out like all of the like steps that, or what it could be with someone.
Yes.
So so if a parent takes their kid to the dentist or something like that, like they're having the evaluation when they're little, would they notice that there's any deformities or something like that that would, get you involved? Or is it vice versa, that you're going to be involved and be like, hey, let's go do this and have like an oral exam?
Yeah, definitely. Dentists are huge. Also teachers, teachers in the classroom can kind of pick up on different things because they spend a lot of time with the kids. But honestly, it's just whichever one they come to first. We do get a lot of referrals from dentists. They can kind of see structurally some things going on. And vice versa, like if they come to us first because they're just like, I can't understand my kid, then sometimes we refer them to a dentist because it's kind of something that doesn't necessarily need therapy. It needs structurally to be fixed first, and then they can come to therapy.
Okay.
So yeah, definitely ENTs is another one that we get a lot of referrals from. A lot of times when kids have to have tubes put in their ears, it kind of, or if they have a lot of ear infections, it blocks their ability to pick up sounds as they develop their speech. And so it can hinder their speech sound production if they're not hearing them correctly. And so we do get a lot of referrals from ENT as well.
This might be a stupid question, but you mentioned lip tie, cheek tie, tongue tie?
Yes. What are
is
those? Yeah, those are huge in the speech pathology world. A lot of babies are born with tongue ties is the most popular one. So it's the frenulum that is underneath your tongue. If you lift your tongue up to the roof of your mouth, you can see the frenulum. A lot of times it's connected too far to the tip of the tongue. And so essentially it restricts the tongue from movement. And our tongue is amazing and does so many things when we're eating and when we're speaking, and that we don't even think about. But if you do have a tongue tie as an infant, it normally shows up in feeding because they're unable to do the sucking motion. And so a lot of times it's taken care of when they're an infant and it doesn't transition into their speech. But sometimes, that frenulum, it can be restricted, but it can still have some movement in it. And so it doesn't really show up in the feeding aspect, and then it shows up in speech. So just saying sounds like L's, T's, D's, anything you have to lift your tongue up for, it just restricts it.
Okay. And a cheek tie?
A cheek tie is the same thing. It's not as common, but it's when the kind of the tissue that connects your cheek to the side of your mouth is too far connected or connected in the wrong area, and so it restricts either your lips from moving or your cheeks from moving.
I've never heard of cheek tie. Okay.
I've heard of tongue tie, but never asked what it was.
Right.
Now's the opportunity.
Yes.
Right. And so, maybe if you're, as they get older and you're like talking to somebody and you notice that maybe they have a lisp or a tongue tie or something like that, it's maybe something that just wasn't addressed. Yes, definitely. And being in this field nowadays, it is very, very, very common. And I don't think it used to be. And I don't think that doctors necessarily looked for it or addressed it. But now they're doing a great job at kind of addressing it within the first few months of their lives. And so it's very easy. You just laser clip the frenulum and then it's fixed. So if someone has that situation, maybe as they get older, when they're teenagers or going into young adulthood, do they have to go through like a full speech therapy to relearn, basically? Because even with just the minor surgery of what it is today, but they're still having to retrain their brain. Yes, absolutely. And that is the difficult part, is a lot of parents are don't necessarily want to do the surgery, which I totally respect. They just want to see how it plays out. The only downfall of that is that you do, once your brain has learned how to say the speech sounds the way your tongue structurally is, and then changing the structure of your tongue, you're going to have to relearn those speech sounds, which can be very difficult. Well, they may be difficult, but is it, like practicing and, having homework and things like that with you on a regular basis? Yes. And the same thing as, when a child is saying the speech sound wrong, maybe nothing structurally going on in their mouth, but they just didn't develop the correct way to say the sound. You have to retrain the brain to motor plan
the structures of your mouth to go into a different position when you make that sound. And so, yes, so that's essentially what speech therapy is. We see the kid, we find the sound that they're having trouble with. We look into how they're making that sound, what needs to change. We teach them the right way to do it, and then we just practice doing it the right way. And they come into speech every week so that we can hear, you're not doing it the right way, you're doing it the right way, and we can kind of just guide them into making that correct production. And then once they're guided into it and they can do it, then just practicing it as much as possible to kind of retrain their brain to do it the right way.
Do you work with children with autism as well?
Yes, yes. They typically have more of the language aspect and just kind of getting them to speak. There's a huge side of autistic children that are nonverbal, and so they don't have any language. And so sometimes we are able to work with them in developing language. Sometimes it's a little bit different than verbal communication. Sometimes it's through a device. Where they're able to, kind of like an iPad, and they're able to hit pictures or plug in different words to communicate if the verbal expressive language is not working. So or sometimes it's sign language, sometimes it's gesturing. And so it's very neat population to work with because we get to work with things outside of expressive communication, but are still very much forms of communication.
Awesome.
That is really cool. So like if someone is nonverbal, like I'm sure it may be different for every circumstance, but is it something with the brain that didn't develop at birth and it just never got, noted until they got older and like the communication should have been at a higher level? Or could it be trauma?
Either, yes. So we see nonverbal in language development, so in younger kids, whether it's something like autism or whether it's just a developmental problem that they're having. We also see it in adults. So sometimes adults can have trauma to the brain, and whether that's like a traumatic brain injury, whether that's a stroke, it's very common in strokes. Whatever it is, the trauma to the brain can essentially, if that language area of the brain did not get the blood supply or whatever it needed and it died, then they no longer have that part of their brain to use, so they can become nonverbal. And so we try to teach them, kind of reroute those neural pathways in their brain to, communicate in another way, to reteach them language in whatever way that they can pick it back up in. And sometimes it's successful and it's amazing. And, sometimes we're unable to teach them a different way. But yes, it could happen during development, or it can happen, as trauma to the brain later in life.
Sure. Yeah. Sorry, Michelle. Go ahead.
No, you're good. I was going to ask. So something you said made me wonder. Do you work with other languages other than English?
I wish I did.
Okay.
There is a great need out there for other languages. I personally just have not picked up another language. My husband and I were actually in England a week ago, and we were just listening to their accents, and I was like, I don't know how I would ever do speech therapy if it wasn't exactly the way I speak, because it would be so challenging to teach other people how to speak when it's not your language, but it would be very interesting. And there are speech therapists out there. Bilingual speech therapists are very, very important and huge, and such a help to our community, but I'm unfortunately just not one of them.
So I have to ask, like, whenever it comes to traumatic brain injury, just whenever that happens, it could be a physical issue, and then you've got, like, obviously the brain is needing to be worked on, and then, as far as the language that happens, like, so do you have, like, an army of people that you can work with, that you're relying on to help you with that particular client?
Yes. And that's another amazing thing I love about being a speech pathologist. So when I graduated grad school, I worked at Baylor Scott & White Medical Center in College Station for my first year and a half out of grad school. And it was amazing. We had physical therapists, occupational therapists directly on our team. A lot of times when patients are rehabbing from a stroke or from a traumatic brain injury, they will need all specialties.
Absolutely.
And then also we work very closely with ENTs. We work very closely with audiologists. We work very closely with neurologists. And so that's kind of, the hospital had every specialty there, but those were kind of the people that I would see a lot on our team, and we would be communicating through. We would have the same patients, and we got to work, since we were all in the same building, we got to work hand in hand with each other to help these patients walk through the traumatic brain injury that they had, which is really, really amazing.
Right. My dad had traumatic brain, well, he's had it twice, but this time was pretty severe. So he was at Shepherd Center in Atlanta. Have you ever heard of that?
I haven't.
Oh, you should check it out. But anyways, I love the holistic approach, like that you have a team that's like, one person's working on one piece and then another's on the other, because it's such a complex issue for one person.
Yes, that's amazing. How is he doing?
He's fine.
He's fine?
Yeah.
Good.
Yes. He didn't really struggle with like the loss of speech.
Okay.
And so it was just everything else.
Okay.
Yeah.
Okay. And that's, the thing about having a stroke or a traumatic brain injury is it's just whatever area of the brain that
the brain is
affected.
the brain is so complex.
Mm-hmm.
Like
it is. It's so interesting. And I feel in this profession I can always learn more about the brain, and I love that. And I want to know so much more about it, because it's amazing in the developmental aspect of, like, when you're a kid and your brain is developing, but then it's also amazing in the rehab aspect and how it can, kind of fix itself, which is really cool.
Mm-hmm. Awesome.
So as far as nutrition and things that people are intaking, or even just like, what they're intaking off of, like TV and radio and all of those things, can those make a major impact on someone's speech and like their therapy?
Yes. I guess we see that a lot more in kids, just like the popular topic of like screen time and those kind of things. As a speech pathologist, I kind of see both sides of it. I have had some patients that have quite literally learned language from Miss Rachel, like the popular YouTuber. Yeah. And a lot of times, like the autism population, like they get fixated on certain things. And so there's different shows or different like YouTube channels that they just want to watch all day long. And sometimes like that's how they learn language, is just hearing it over and over and over and over again. And that is how we learn language, is hearing it over and over and over again. And so I can see it being beneficial sometimes, especially for the autism population, because that's just kind of how they pick up things. And so, but then I also see, the side of hearing and getting in-person interaction is also so important. There's a side of speech that's called pragmatics, and that's kind of like the social communication. So it's, using gestures, body language, all of that to communicate. And I think that having in-person communication and getting, that live interaction with someone, whether it's a parent or a sibling or a friend, is also so important in development, because if you don't get that, then you're going to, not be able to develop social communication skills, which is, we see some kids that can speak totally fine. They have great language. You can understand them, but socially they're having a hard time communicating with others. And so that's another side of speech that we work with kids on. And I think that that's where, having that in-person communication is so important.
I have a friend who has a son with autism, and it's funny you mentioned about the iPad. Mm-hmm. When I was around, I now know what's happening, but he was looking at the iPad and he would say, bus. There was not a bus on the iPad, but then a bus would come on the screen. Yes. He was calling what was going to happen before it happened, so it took me a minute to figure it out. But anyways, yeah, he apparently, he's learning speech through the iPad, like you are mentioning. That's neat.
And it's amazing, like they see it so many times, and then, that is how they learn speech, because they know what's coming next, and so they're able to say it. And we always, preach on nursery rhymes and reading the same books each and every night, because kids will pick up if they hear it often enough, they will pick up what's coming next and they'll start filling in. And that's a lot of times how kids say their first words, or how we hear kids talk for the first time is doing something over and over again and then kind of just like letting them have it and they'll fill it in. And it's really neat to see them develop speech that way.
Mm-hmm.
So whenever there's a little one, and, you know, I think we all tend to, like, if there's a little bitty kid come in, we talk to them kind of baby talk. Do you not encourage that?
Yes, I shouldn't encourage it because technically it's not appropriate, but I totally catch myself doing it, you know, with my nieces and nephews and little ones in my family. But the thing with that is kids pick up how to talk by the way we talk. And so a lot of times, like if kids call their water Wawa or Baba for bottle, and then we pick that up and we're like, do you want your Baba? That's what they're going to think bottle is, or how to say bottle. And so it's really important to be a great example of language for your children. And so just by talking, you know, normal words, adult language, that's what they're going to pick up. And so I do, like with my family and friends that have little kids, you know, if they're like doing the Wawa or Baba or, you know, using that baby language, I always try to, you know, tell them like, try to say the full word so, you know, their kid is able to hear the full word and know that that object is called a bottle, not a Baba, you know. And you can correct that later on in life, but I just think it's something easy for adults to, you know, if they're able to do that, then it just sets their kid up for a little bit better speech development.
That makes a ton of sense. Yeah. So rather than the parents adapting to the word that the child is using, just continue to, but you're acknowledging by giving them the item that they're asking for, even though they're not saying it correctly, you say it correctly back and acknowledge that that's the same thing. Totally makes sense.
So they say, I want my Baba, and then here's your bottle.
Exactly.
Yes, that's exactly it. I also get so many parents that come in and they're like, I love the way my kid talks. Like, it's so cute. And I know it needs to be corrected, but I just like, I love it. Like, they don't say their L's right. It's a W, or they don't say their S's right. And it's so cute. And I'm like, I know, it really is cute. It really is cute when you hear kids talk and they might have like a little sound deficit somewhere. But it's also one of those things that you just want to set them up for success, right? And the earlier that they're able to correct those speech sounds, you know, there's an age where it's not so cute anymore, and it's, you know, it's like hindering their ability to learn how to read or speak in front of their class. And so that's one I get a lot too. It's, you know, parents that are like, it's so cute though. And I'm like, I know it's cute, but
take a lot of videos of it now, and then let's work on this for the future. Yeah.
Yes.
Okay. Exactly. So I have a funny story that goes along with what you just said. My mother-in-law's passed. But one of the things she used to share with us was she had a friend whose name was Weta. Not Rita, Weta. And she avoided the friend in front of anybody or that didn't know Weta already, because she didn't want to have to introduce her. Because she thought people would think she had a speech impediment, I guess, or, you know, and so she would never introduce her if the occasion came. She was like, I would just be like, here's my friend. But anyways,
that's funny.
Hilarious. Yes. Her name was Weta.
So is stuttering something that you work with as well?
Yes, definitely. And that's a tricky one too, because stuttering technically there's not a fix to it. There's, you know, and you just kind of have to learn strategies to kind of get around it. Strategies, whether that's being, you know, calming yourself down, or, you know, just going about situations in a different way. They can be like outward strategies. They can be inward strategies, like taking a deep breath, pausing, you know, different things like that. But there's no cure, was the word I was looking for. There's no cure to a stutter. You just kind of have to teach modifications or strategies to enhance the fluency. And so it's really interesting to work with that population, for sure.
It's so interesting to hear someone who can't speak without stuttering, but then they'll pick up a microphone and sing and not stutter once. How does that happen?
Yeah, it's just, and singing is great. Music therapy is great for speech pathology, or speech therapy as well. Just because how the brain works through music is very calming and very different. And a lot of difficulty with speech comes from stress. And so we tell our patients that stutter, our patients, there's something called aphasia, and that's when you, there's different parts of aphasia, but one aspect of aphasia is you can't think of words to say. And so
I have that sometimes.
You do?
We call those brain farts.
Yeah. And so it stresses people out. Stuttering is stressful. The not being able to think of a word is stressful. And so when they put more stress on themselves in those moments, it makes it harder. And so a lot of the therapy that we do for, those two things is just taking deep breaths, calming down, doing different outward things to help the brain be able to find that word or to get that word out.
Almost the same tools as you would use for anxiety.
Yes.
Okay.
Yes. Yeah. And so, therapy, sometimes a huge part of speech therapy is being a counselor. And I've definitely, they told me that in grad school and I was just kind of like, what? Like, not counseling? And now that I've been in the field for a few years, I'm like, wow, some days I'm just a counselor. I'm just we're not doing any speech today. We're just talking through what's going on because, a lot of the rehab side of it, they've had these traumatic things happen in their life. And when they let that, take a hold of their bodies or their brains for that day, it's hard to speak. So it's all correlated. It's very interesting.
Very. We feel like counselors sometimes too in real estate, don't we?
Yeah.
Marriage counselors.
I just finished a really intense session earlier today.
Yes, you did.
So I want to ask you, I'm confident that it's different with every single person, but if someone was like, hey, I want to call her up and I want to do this like for my child or maybe someone in my family is dealing with this, how long of a process is it usually before they start seeing progression?
It is different for everyone. And I know that's like the answer that moms typically don't want to hear. They're like, I want to know. But it really is different for each child and just kind of what's going on. I've had some patients that are in speech for a month and they just need, a few little corrections and they, are able to pick it up really easy. And then I have some patients that are in speech for years on years and there's no right or wrong. It's just how the child develops and picks it up or how the patient, if it's an adult that's going through rehab, is able to get through the rehabilitation. But I will say something so important with speech is the homework aspect of it. So we typically see our patients once a week for 30 minutes. That's like a typical speech therapy, and they come weekly to us. Mm-hmm. And so in the, your whole week, one 30-minute session is not a ton. And so being able to practice at home. And so we do a lot of, the patient comes to us for speech, but we always invite the family, the parents, the caregiver, the wife, whoever it is, to come in with them because we want them to see what we're doing and we want them to take that home and practice it at home with them. Especially parents, they have the most interaction with their child on a day-to-day basis. So if they're able to take what they see us doing in the speech clinic home and practice it at home, that's where we're going to see the most progress. And same with adults that are going through rehab, being able to practice at home because the brain's not going to be able to rehab itself if it's just getting, once a week for 30 minutes practice.
Mm-hmm. So like you said, you're stepping into like a counselor role, therapist role, rehabilitation, all of those things. But I'm sure this is like really high on an emotional level for you and them. But are you having to adapt to like their personality types?
Yes, very much so. And, I love that about speech. It keeps my days very interesting because I have all different kinds of patients come in. And especially kids. Kids have so many different types of personalities, so that's always fun. But it's really interesting from the rehab aspect of it because a lot of times when patients have traumatic brain injuries or strokes, if they have it in an area of their brain that controls their emotions and controls their attitude and perspective on life and all of those kind of things, it can really be damaging. And then they also just had like this traumatic event that happened in their life. So there's a lot of, different routes that, sometimes they don't want to do it. And, their families are like, no, you're going to do therapy, and they bring them every day. But the patient's like, I do not want to do this. And so, you just kind of have to work through all of those things. And it makes you, it's a very rewarding job at the end of the day, to get to walk with patients that are walking through that path.
So tell us about your most rewarding.
My most rewarding. Oh my goodness. There's the children that have said their first words. And I think that's super rewarding because it's not, the kid doesn't necessarily know what they just did. It's not rewarding from them, but from looking at the parent and seeing just the relief that comes off the mom. I cannot imagine, having a child that cannot communicate, and if you're dropping them off at school and you pick them up and they can't tell you, how school was or what's going on, like I can't imagine that. And so I don't have kids myself yet, but I always try to put myself in their shoes. And I really, it's super rewarding when that child starts to develop language. And I can just see the relief taken off the mom, of like, yes, my child can communicate with me. And it's not like it's an overnight thing. It takes so many months of work. And then once they do start talking, it takes even more months of work to try to, keep them talking. But then I also, I love my rehab patients, that they know how to talk because they've, had language before and they've lost it. And so when they get it back, it's like a light bulb goes off in their head and they're like, wow, like I'm speaking again. It's something so like we take it for granted so much because we speak all day, every day. But to see someone who has lost it for an amount of time be able to get it back it sends chills down my body. Mm-hmm. It's amazing to see because it's like they have worked hard and they're seeing the reward, which is really cool. Mm.
Can you talk about a really struggling experience or something that was really, really hard?
Yes. I would say I do have that one. It's a patient that had a form of dementia. And so she was slowly losing her ability to communicate. And just having to walk down that path with her and her family, they didn't really know what was going on. In the form of dementia that she had, it was called primary progressive aphasia. And with this form of dementia, speech is the first thing to go. So it was kind of not only watching her lose her speech, but it was the first thing in this dementia that she lost. And so her family was obviously distraught about it, and respectfully so. And so anyways, just having, like I said, sometimes we can retrain the brain, but kind of with more dementia cases, they're losing their language. And so, I tried to set her up with the device as she lost expressive communication, tried to set her up with the device, but that was unsuccessful as well. And so there are cases where, they don't always leave talking, or even communicating in any aspect. And, but, just being there, transitioning from the speech pathologist, if there's nothing else you can do, as a speech pathologist, and just being there for the family kind of as like a counselor and, walking through that with them.
That's really heavy.
Yeah.
It is heavy. That was like, I left work after that case. I was like, I can't do this anymore. I'm done for the day. Like, I got to go home because it is. And I was a new grad when this happened, and I had the best coworkers surrounding me, and, they're like, it's not, you weren't supposed to fix her. It's not, you're not God. And, this is just what's going on in her life. And, you did what you can. And
yeah, it's almost an impossible task you were given. I mean, I would assume that after the speech goes, her ability to remember what you've taught her is going at the same time.
Yes.
So, yeah, gosh, that is heavy.
When you step into a role of like what you're doing or what healthcare providers do, like it's just one of those, it's like you'll always remember the one. Like, you had so many good stories, and you were like smiling from ear to ear talking about the wins, but then it's like when you had that struggle, it's like that stuck with you, and it will for a while, but you can't have the wins without having to endure the hard stuff too.
Right. 100%. Absolutely. And that's what makes this job rewarding, and keeps my heart in it.
Wow. Yeah.
I learned a lot.
I know, absolutely. I did want to ask you though, so as the years have progressed, like I think our generations have went from like having phone conversations to now you're texting all the time and emailing all the time. And then, you know, when COVID happened, no one was seeing each other face to face. Like, are these things impacting language for others?
Yes, absolutely. I was in a unique situation because I kind of just graduated. I was in grad school during COVID and graduated whenever the COVID babies were reaching 2 or 3 years old. And I think speech pathologist has always been, you know, a high need, but it drastically went up during that time because a lot of the COVID babies that weren't getting that interaction, or they were learning language by people wearing masks, and it was covering their mouth. It was covered, like they couldn't see how, you know, our mouths were moving to speak. They couldn't hear the sounds correctly. So we saw so many children around 2 or 3 years old that were delayed in speech. And I don't even think we've recovered from it in the speech pathology world. I say we. You know, the wait list to see a speech pathologist is crazy nowadays because there are so many children that are delayed because of COVID. And I also think, like you said, just kind of the shift of our cultural into a less face-to-face interaction. So we are definitely seeing a higher need of speech therapy in kids nowadays.
Wow. And it's weird, you know, you think about it, it was just like, that was 5 years ago or 4 years ago for these kids that were COVID babies but it's just like, you know, they're getting ready to go into school, you know, and then the school system and all that was broken too. And so it's going to be a very interesting future for these kids. They're going to have to endure a lot.
Yes. Absolutely.
Yeah, I think probably the COVID, I have a grandbaby who's a COVID baby, if you will. He'll be 5, or he just turned 5 actually. But anyways, it's, he wasn't in school or, you know, somewhere where people were wearing masks. So he wasn't as affected, I'm sure, as someone, but that's such a good point you bring up, you know, that they couldn't see the lips. They couldn't see the tongue happen. They couldn't see any of that. Yeah. Interesting.
Yeah, but that's why we have warriors like you out there, you know, and, you know, bringing inspiration to others, and so they can get, you know, knowledge about what they can do if they're struggling with their families and everything. So if someone wants to connect with you, how can they find you? Are you online?
Yes. So I currently do all teletherapy. And so my company is called Prevail Speech Therapies. And so, yeah, you can Google me online, and I have a website, and you can, you know, book in for like a consultation if you just kind of want to talk about what's going on with your child. I know a lot of times parents, they know something's going on, but they don't know if speech therapy is really what they need. And so I always do like a free phone call consultation just to kind of, you know, talk about what's going on and if speech therapy is even the right answer. And then we typically do an evaluation, which is kind of like, you know, testing the kid for, you know, if it's speech sounds, we'll kind of go through all the speech sounds, see where their deficits are. If it's language, we'll do a language exam and see where their weaknesses are. And then we'll set them up for therapy. And we typically see kids once a week for therapies. If they need twice a week, we can do that as well. But yeah, that's and awesome. I do it all on teletherapy. I'm in between Texas and Michigan. And so I do it all virtually, and that's it.
That's great. Yeah. That's awesome. Thank you so much for being on with us
today.
Thank
you for having me.
Of course.
Yeah, it was nice to meet you. Nice to get to know you. Yeah.
Yes, y'all as well.
Absolutely. And so if you want to connect with her, you've got the information. And if you want to talk to us, you can find us at texastrioteam.com. Thank you for tuning in. Take care and keep living your best life.